Welcome to lesson one. We're going to start talking about critical thinking and the decision making around these emergent events such as code blues, rapid responses, and those type of events that you may come across. So, what's the difference between critical thinking and decision making? A lot of people try to put these into their own category, but you can't have one without the other. They're two sides of the same coin. You can't be a good decision maker without having the critical thinking skills to back up those decision making processes that you're going to do during like a clinical event. So critical thinking is the process of analyzing, evaluating the information to make these informed decisions. You can't necessarily critically think to the fullest extent during one of these emergent events. And you can't make good decision making weighing the risks and benefits and considering all the information in those emergent events without having some form of already evaluating what steps you would take or how things you would change. And we'll get into these in the next slides here. But being able to critically think and make the preparations to clinically decide what's best for your patients is going to actually empower you to take those appropriate actions. So critically thinking can be broken down into these three portions: analyzing, processing, and rethinking. So analyzing goes beyond just the capture of the data. So what was the patient's heart rate? What were you, what steps did you take? What did you do in reaction to what you saw? You have to analyze it further than this. And you can take it as far as you want to go. You can break down minute by minute or every 15 minutes or however works best for you. But you need to you have to go beyond the surface of analyzing what is around these events and what will eventually help you in making those decision making processes. And when you're processing this data after analyzing it, this is where you start to understand how everything connects. This is where you make the connection between that low heart rate and that low blood pressure and understand that what those two, how those two pieces respond to each other and what is happening to your patient in their decompensation or in their emergent event. And then the last part of critical thinking is rethinking. So this is by far the best portion of critical thinking. And this is where your actual like superpowers come from, is the ability to say, was this the best way? Did my patient get the best result for what I did or what we did as a team? And is there another way that we could have done it to get the same result? Because this is where you're going to start seeing that patients start being kind of like each other in a sense, even though they may present a little bit differently, but the decision making ends up following the same pattern. And being able to have already thought through how it affects this one patient, you're going to see that this other patient, oh, this is kind of similar, but this is how I need to change it to make the appropriate actions for that patient. And we'll get into rethinking here in a bit. Now, as we talk about the clinical decision making, this is where school tells you you need to be able to quickly think and be decisive in these moments for when it counts for these patients. Because when we're talking about code blues, minutes count. And this is why critical thinking is the lead up to decision making, because you can't make quick and decisive decision-making skills for your patient within those critical events. It's impossible. And the amount of time and times you'd have to be in those events would be astronomical to be able to get to a point that it would make the best difference for your patient. So it can feel difficult, especially in these urgent situations, but this is why we go through the critical thinking process to evaluate how we make our decisions and be able to know that the process that we're taking and owning that step-by-step thinking process to decision-making process will make us into the nurse that we need to be for our patient in that time. So sprinkled in this lecture and a few of these other ones, and as we get into the patient scenarios at the end of the course, you have to imagine yourself in real life. You have to take what I'm gonna give you my real life clinical experiences that defined my clinical practice and made me rethink the way that I needed to learn critical thinking and decision making to have better outcomes for my patients. So when you go through these, think of what you would have done. How would you react to the situation? Where would you improve your clinical practice for a patient in the similar scenario? So this first one is literally from my first clinical rotation during nursing school. I was, bright-eyed and bushy-tailed, ready to go make a difference and learn how to be a nurse. And I go to the unit, I meet my preceptor, the patient that was already assigned to her was down in IR getting a procedure. And how the hospital worked, part of the process was that when the patient was done, due to the limited IR staff, the staff from the unit went down to pick up the patient and bring them back to the unit. So that's what we did. Got the call, got report. All the patient's vitals were stable. The procedure went well. It was time to come back to the unit. So we went down. I think we were located on the 4th floor of this particular hospital, and we had to go down to IR, which is on the 2nd floor, so not too far away. And when we got there, we picked them up. Everything was fine. And right as we get to the elevators, and by the way, this is like a long hallway from IR back to the elevator to go to our floor. And it was a Saturday, so there wasn't much of bustling around and everything. So there weren't that many staff members just walking down the hallways. We get to the elevators, we press the up button to get back to our unit, and the patient's monitor just went straight VT. Check a pulse, like my preceptor checks the pulse, tells me we need to start CPR and we have to get back to the unit. So I'm like, okay, this is going to be a lot like TV now. So she told me to hop on the bed so that she could push us on the elevator and we could get to the unit while I'm doing CPR. She says, just do CPR, don't stop until we get to the unit. And I'm like, okay, this is my first time doing CPR, and other than on a mannequin, and it made me think. It was like, what should we have turned around and went back to IR, or should we have done what she did and continued to go to the unit? And I mean, we got to the unit, we pulled into the room, everyone was like, saw us coming through and saw me up on the bed doing CPR, so like everyone knew to come in and help us. But when it was all said and done, like what I gained from this was like she knew exactly. It was like, we can't turn around and go back to IR. We need to go back to the unit. That's where we're going to have the best support. But maybe, I mean, I was just thinking, I was like, why was that the best option? Like, would it have been better to not get on the elevator? Like, what are the chances of getting stuck on an elevator, or it being slowed down by going to another unit or etc. Too many different scenarios. But it was like I just put myself in that situation. I was like, what would I have done if on a typical day this was me going to pick up my patient? I would have been by myself and I would bring in the patient back. Like, what would I do? So what I knew that I should do going forward is that I should start a way to figure out how I'm going to deal with these situations. So I learned to analyze what just happened I wrote it down. I had just a 3-ring college ruled notebook that I wrote down what happened, how it made me feel, like all the different aspects of it, what was happening with the patient, all their vitals, what I could remember. And I put all these onto the paper. And then I tried to go through and immediately start doing that. But then what I realized I needed to do was I needed to step away. I needed to give myself some time for the adrenaline to wear off and to come back to it with a fresh set of eyes, so to speak. And this is where you start processing all the data that you just got. So you fill in the gaps. And when you're reviewing your notes, it's like, oh yeah, that did happen. That was a very key and important thing. So I highlight it. And then I'm like, okay, why did this happen? So then I start filling in the knowledge I didn't know about the disease process or what was going on with the patient. So that as I'm looking through this whole thing, I'm starting to build this dossier on this type of patient. And then I'm able to start rethinking about it. And that's where I was like, was this the best way we go through it? Is this the most easiest way to get to the result for that patient that we need? How would I have changed if this happened? If this little thing changed, if I was already on the elevator, if I was coming down the hallway, or if any of those little variables changed, like how would I change what I do? And this is where I started thinking about if I'm able to think through these scenarios now when I have the time to think about them, it would help me in my clinical practice because I would now at least have already thought about it. I already put myself in that scenario. I've already been able to take what I do know and then apply it to what I know. And since I wrote it down, when I start learning new things, read a new thing or get a new experience, I could go back and go, okay, this is how I'd end up changing it going forward. This is what I would do. This is my process. And this is what would make me what I need for my patients. And it's not easy. And it's not something that just clicks and it goes every night, but it just became part of how to handle these tough situations, in that when your patient needs you the most is during these situations when it feels like you can't have even the time to think. And that's why being able to sit down and go through these scenarios and build your own virtual experience to apply to eventually your real life experience will be the best way to get to the results that you need for your patient. And I challenge you before you move on to the next one is, if you've had any code blue events that you've experienced, can you remember anything that helped you in those situations? Can you remember anything about them that were defining? And just write those down. And as we start going through this, you'll start building these out so that you'll be able to rethink and be able to process and to analyze as we go through this, and it'll become easier and it'll be more second nature by the time we get done. Next up, we'll have preparation for the Code Blue and Rapid Response events.